In the last chapter, you learned that bariatric surgeries help you lose weight by limiting the amount of food you can eat or limiting your body's ability to absorb calories. In this chapter, I'll describe the two most common types of procedures performed, list the benefits and risks of bariatric surgery, and discuss the qualifications to become a surgical patient. The first procedure is the sleeve gastrectomy. During a sleeve gastrectomy, our surgeons carefully remove about 75 to 80% of your stomach so that a narrow tube or sleeve of stomach remains. This limits the amount of food you can eat and may also cause your body to produce less ghrelin, the hormone that makes you hungry. The sleeve gastrectomy is a permanent surgery. It cannot be reversed. This surgery often requires an overnight stay in the hospital. Next is the gastric bypass. During this procedure, the surgeon divides the stomach to create a small pouch at the top and then connects the pouch to the small intestine. The part of your stomach that remains functional is about the size of a walnut, so you'll only be able to eat about an ounce of food at a time. It also may cause your body to produce less ghrelin. The gastric bypass is reversible, and most patients stay in the hospital for 1 to 2 days after surgery. The sleeve gastrectomy and gastric bypass are both laparoscopic surgeries. During laparoscopic surgery, the surgical team uses a camera connected to a thin, tube-like instrument to help them operate. Unlike open surgery, where the incision is much larger, a laparoscopic surgery only requires a small incision. This often results in fewer complications, a faster recovery, and less scarring. Bariatric surgery is one of the safest surgeries when compared to other common operations. But when deciding whether surgery is right for you, it's important to carefully weigh the benefits against the risks. There are many benefits to bariatric surgery. For most patients, bariatric surgery is the most effective treatment for long-term weight loss. Research shows that it may also help you live longer and reduce your risk of death caused by obesity-related diseases such as cancer, heart disease, and type 2 diabetes. The benefits are clear, but what about the side effects and risks? Our surgeons are certified experts in their field and take every precaution when it comes to patient safety. Yet, there are risks associated with any type of surgery. These include bleeding, leaking from surgical staples, blood clots, and adverse reactions to anesthesia. Side effects and complications of bariatric surgery are not common, but may include chronic abdominal pain, vomiting, obstruction or hernia, constipation or diarrhea, gas and bloating, heartburn, anemia, hair loss, dumping syndrome, and kidney stones. In rare cases, patients may need a follow-up procedure to address specific complications. About 2 to 8% of patients who have a sleeve gastrectomy may need a follow-up procedure to address severe GERD or acid reflux. About 4 to 10% of patients who have a gastric bypass may need a follow-up procedure to address complications such as ulcers, dumping syndrome, small bowel obstruction, and malnutrition. Your surgical care team will take every precaution to minimize your risks and reduce the chance of complications. This will include making sure your body and mind are prepared for surgery, prescribing vitamins and medications to help your recovery, and providing support to change your habits and improve your lifestyle. Following the advice of your care team will improve your experience and the outcomes of your surgery. Now, bariatric surgery is not a weight loss option for everyone. To be considered a candidate, you must meet certain qualifications. Most health insurance plans use these to determine your eligibility. The first qualification takes into account your weight, health, and body mass index, or the estimate of your body fat. To be eligible for surgery, you have a BMI of at least 40, or you are more than 100 pounds overweight. Or you have a BMI of at least 35, and you have at least one obesity-related condition, such as type 2 diabetes, high blood pressure, sleep apnea, or high cholesterol. The second qualification relates to your health and well-being. We take every precaution to ensure your overall health and safety. Therefore, your medical team will perform a comprehensive evaluation to make sure you're physically and emotionally healthy enough for surgery. This includes being free of addiction. The third qualification is that you've tried other weight loss strategies recommended by your doctor, but you haven't been able to keep a healthy weight. The fourth qualification has to do with your readiness. This surgery will have a big impact on your life and will require major lifestyle changes. If you don't commit to these changes, it could impact the results of your surgery, lead to complications, or even cause long-term medical problems. In the next chapters, you'll learn more about the commitments you'll need to make before and after having bariatric surgery. Think about each one carefully. Your weight loss success depends on it. But first, let's check to see if you're a strong candidate for bariatric surgery. I'll ask you a series of yes or no questions. At the end of the quiz, you'll add up your responses and I'll give you your results. Are you ready? Question 1. Do you have a BMI of 40 or more, or are you at least 100 pounds overweight? Question 2. Do you have a BMI of 35 or more and at least one obesity-related health condition? Question 3. Do you feel physically and emotionally healthy enough to undergo surgery? This includes being free of addiction. Question 4. Have you tried other weight loss strategies recommended by your doctor, but you haven't been able to keep off the weight? Question 5. Are you willing to make lifestyle changes to support your weight loss? If you answered yes to at least 4 of these questions, you may be a good candidate for bariatric surgery. During your initial consultation, your care team will perform a more detailed evaluation to make sure surgery is your best option.